read the news so that you don't have to. Imagine that you call your GP and you try to get an appointment and they say, yeah, that's fine, it's free unless you want to be seen this week. Welcome to the slow death of free healthcare in the UK. So this headline says, private healthcare in the UK helping or harming the NHS. So let me give you some quick context to the article. Obviously, you know the NHS was built on one core idea, that it's free at the point of use, no matter what your income is. But here's what's been happening behind the scenes. GPs are overwhelmed, costs are rising, and funding isn't keeping up. And one doctor in Derry, after nearly going bankrupt, did something controversial. He kept NHS care free, but introduced a private paid service on the side just to keep his practice alive. And he's not alone. This isn't just one desperate GP, this is a structural shift that we're seeing. Private healthcare is booming. 939,000 private hospital admissions in 2024, a record. 6.5 million people now have private health insurance in the UK, which is the highest in 25 years. Why is this happening? Because people are tired of waiting. And here's where it gets kind of uncomfortable. The NHS is already quietly relying on the private sector. Around 10% of non-emergency NHS treatments are done privately, and in some areas like cataracts or ADHD, it's closer to 50%. So the line between public and private healthcare is basically gone. But here's the real tension, because most consultants work in both systems. So now what's happening is you've got to battle for time, staff, and resources, and we've seen how this plays out. Dentistry. Try finding an NHS dentist right now. Exactly. That's what happens when private work pays more, the public system gets hollowed out. So where does this go? Well, there's two possible futures and two main arguments. You've got the pressure valve argument, which essentially says that private healthcare helps reduce NHS waiting times. People who can pay step out of the queue. The second argument is the two-tier system reality. The wealthier get faster, better care, and everyone else waits longer in a shrinking system. Here's the real risk that nobody's talking about, because once people start paying privately, they may stop supporting the NHS altogether. One expert put it bluntly and said, we're heading towards a system where basic care stays free, but anything beyond that, you pay. So when it comes to private healthcare, the real question is, are we fixing the NHS or are we quietly replacing it? Because once that shift happens, there's no going back.